In this video, we're going to cover how and where the ECG placement is for a 12-lead ECG. In a separate video, we'll actually cover a 5-lead ECG. So there's 10 electrodes that make up a 12-lead ECG, and you'll learn about the different combinations. So we'll start at the top and we'll work our way down. So right and left arm is mid-clavicular. So what we do is feel both ends of the clavicle and then just go on the inferior aspect of it and mid-clavicular. And the same thing for the left arm. And remember, it's the patient's left and the patient's right. And when we put the electrodes on, remember, ECG doesn't go through bone, so the ECG is going to actually be just below the clavicle. The next placement we're going to go to is what's called V1 and V2. And these electrode placements are the one that students typically have the most difficulty locating properly. Now, there's two ways to do it. The easy way is if the patient has what's called an angle of Lewis, which is a bump on the sternum that you can feel. And then once you find that, you immediately go inferior and to the side, and that puts you into the second intercostal space. And then you go third intercostal space, fourth, and then on both sides, and that's where both electrodes are going to go, V1 and V2. And again, we don't put it on bone, so it's going to go as close to the sternum as possible on both sides. However, most patients won't have the angle of Lewis. So what we have to do is palpate down and go, there's 1, there's 2, there's 3, there's 4. And we'll show this on Nathan, who's kindly volunteered for us. Now, the next electrode that I tend to put on because it's the easiest is the V4 electrode. V4 electrode, you go to the mid-clavicular and we go down to underneath the pectoris muscle. And again, it can't be placed on muscle and it can't go on a rib, so it goes in the gap. Okay. Once we have V4, the V3 electrode is equidistant horizontally and vertically, and that's where V3 goes. I now jump to V6, which is mid-axillary. So you have the patient lift their arm up slightly, and we go the armpit, go down, and in line with, we know there's a slight curve to the ribs, mid-axillary. And then V5 is equidistant between V4 and V6. Then we have the right leg and left leg, and we put those in relative to where the oblique muscle is, or you can go up just to below the ribs. Now what we're going to do is put the electrodes on the actual patient. Again, we're fortunate, we've got Nathan volunteering. What I want you to do is when you look at the electrode, you can see the gel that's in the middle. That often dries out. So if you find that the gel, there's not a lot of gel there, take the conduction gel and just put a dab of it right on the electrode. And that way we're sure there's good conduction. So these are all brand new electrodes. So remember how I said mid-clavicular and on the inferior aspect, and that's the right arm. Now we're going to do the same thing for the patient's left arm. Again, mid-clavicular, just on the inferior aspect. Below. Now, I'll check Nathan. Nathan has an angle of Lewis, so I can push in, and when you're in the class and the labs will go through it, I can feel that gap. That's the second intercostal space. That's the third. That's the fourth. Now, it's supposed to go, the V1 and V2 electrodes are supposed to go in the fourth intercostal space. However, this is where you have to use clinical reasoning. If I put electrodes here, Nathan, can you do me a favor? Put your hands together and push. You can see and relax and push. It ends up being on muscle, which you can't do, and we'll talk about this with women as well. Relax. So what we're going to do is go up one space. So again, we'll go the angle of Lewis, go 2, and right there's his third intercostal space. Now, that's his sternum, so we want to ensure that this part of the electrode, that's the sensing part, is right in up against it, and not out here. Because again, if it ends up on the pec muscle, we're going to get an EMG instead of an ECG. And we'll just do that to palpate it to make sure we're in the spot. There we go. Now, even though Nathan looks very symmetrical on his chest, it's always recommended that you palpate both sides just to make sure, in case there is a difference, that the electrodes are in the right place. And again, right up against the sternum. Now, if you remember before, I said the next electrode I tend to put on, because it's easiest, is we go mid-clavicular straight down. Now, if I put it in that gap, that's going to have some of his pectoris muscle in there, so I'm going to go to the gap right below and put that there. So that's V4. Now we're going to go to V3, and as I mentioned, V3 is equidistant horizontally and vertically, and that's going to go here. Now, the next electrode that I put on is the V6 electrode. When you go to do this, the patient, can you lift your left arm up high, is going to want to lift her arm up high, but what happens, it moves all the skin. So what I recommend you do is just get them to bend their arm a little bit, go mid-axillary. You can see how that rib goes around, and we're just going to go mid-axillary there. And last will be the V5 electrode, which is equidistant between the V4 and the V6. Now we need to put on the right leg and left leg electrode. So we're going to go, that's his iliac crest, and we're just going to go, now do me a favor, pick your right leg up, because we don't want that moving. That's fine, relax. And feel for his iliac crest, yep, and right there. Now, this is a 12-lead ECG setup. Half the patients you may see will be female, and no different than putting it on the chest muscle is putting it on the breast muscle for women. So if we look at Annabelle, who's kindly volunteered for this, if I go down, she has a slight angle of Lewis, but notice that if I go down, that's 2, 3, or 4, I'm going to end up being on breast tissue. Again, that's not an ECG, it's an EMG. So what we need to do for the women is you come up one notch. If that's still on breast tissue, then come up another notch. And that's good clinical reasoning, okay? And quite often you're going to have that. Now, males, if you have a female patient and she's not comfortable taking her shirt off, if we do a 12-lead ECG, we've got to put mid-clavicular, V1, V2, and then I've got to get around here. Annabelle or the patient might not be comfortable with that. So what we can do is a 5-lead ECG. We go mid-clavicular on both sides, we go right leg, we go left leg, and then all we need to do is put a V5 electrode there. But we always ask the patient, if they say, no, I'm not comfortable doing that, then you don't do the ECG. Or if you have a female colleague that you're working with or on placement, they can alternatively, you could ask if she was comfortable doing that. Again, it's important. We can't put the electrode on bone because it won't conduct, and we can't put it either on breast tissue or on muscle tissue. Thank you.